Hello viewers, once again I have come with interesting topics for us to really digest that is geared towards improved health, our health system and better health for you and I. Like I've always said, health is wealth. There should be that symbiotic relationship between the medical laboratory scientists and you the public, because that will bring about a better health. Today's topic is the carriers of diseases. But we should not misunderstand this carrier as the understanding we have for cargo planes, aeroplanes that carries loads, carry all these products, nor for people who carry drugs, drug carriers, nor for vaccine carriers. Carriers of disease are very important to note because they are considered dangerous. I will tell you some experiences that you need to know to come to that conclusion that was written even in the headline news, which I will expose as I speak along. Let us take this moment to really understand that carriers are people who harbor diseases. They harbor disease, but there is no oversight. They are not showing the signs and symptoms associated with such diseases. A very good example, I have about 3 examples that I shall present. The situation of a woman and her son that visited the laboratory as requested. She brought her son from which was showing indicating urethritis, a discharge, to confirm if it's really Neisseria gonorrhea. So I had to take the discharge from the penis of this 5-year-old boy, and within 5 minutes I was able to identify that the baby was infected with Neisseria gonorrhea by displaying the bacteria, Neisseria gonorrhea, in the gland state. It appears intracellular and extracellular gram-negative cryptococci. That is a very typical picture, very characteristic of Neisseria species. But for that area of discharge, it is easy to conclude that the patient has the species Neisseria gonorrhea. So I asked the mother, where does this child, where did he get it from? And the mother was trying to explain silently, and I asked her again, do you bath with your child? Do you use your towel or anything with your child? Then she explained that she usually bath every day with her son in the bathroom and dry up using a towel to clean herself and the child, even the child's private part. I said that is where you must have transmitted. But let us confirm whether you yourself have the Neisseria. So she also was tested, and behold, she was also positive. So I recommended that she should also bring her husband for test. There is another scenario, the one I've spoken about in the past, tuberculosis, Mycobacterium tuberculosis. The tobacco bacilli has lived many millennia. At least when you are talking of Salmonella typhi, it is as recent as the 1869, around the period this woman was born, Mary Malone. But when you talk of tuberculosis, tobacco bacilli, it has been on for millennia. So it's not 1 millennium, 2, so we are almost talking about going to the 3rd millennium. We are probably already in the 3rd millennium, sort of. The understanding is very clear when you talk about the tuberculosis. Tuberculosis has chronic carriers, that is people who avoid it. It also have temporary carriers, people who will have it for 6 months or thereabout. But the most important issue with mycobacterium carrier is the immunocompromised patients. You may have it in you, but the moment you become immunocompromised, the Tuberculosis now come out as with its usual symptom and sign, the purulent discharge of sputum, which ultimately will cause serious disease in the patient and makes the person very, very weak. That is another carrier. We have the one that surprised, that really brought into limelight the carrier issue. It is that of Mary Malon. Her name was changed to Typhoid Mary when she as a cook infected so many people. Up to 53 people were recorded as infected by her. But because the health system is so perfect, or almost perfect in New York, they were able to detect that she was the source of the Salmonella typhi organism. And they tried to even advise her so that she can go for the operation of removing her gallbladder. The gallbladder is where the Salmonella typhi reside in the carriers. So that if that is removed, she will not be affecting many people. That's where she was now considered as a dangerous person, because she continued to excrete this Salmonella typhi, and she continues to contaminate foods because she's a cook. And she disagreed. She did not agree to that surgery to remove her gallbladder. What happened next was that she was quarantined, and she appealed against it. She sued the government, and you can imagine how eventually she lived for 69 years, but eventually New York is free of Salmonella typhi, but Africa still has it endemic. So why is it still endemic in Africa? The excuse you hear people give is that our water system, which is true, our sanitation is poor, our hygiene is poor. Yes, all these are true. But if there is no Salmonella typhi around this environment, there will be nobody transferring it even in a situation of water, and go. But that source are the carriers. These carriers are the source of this disease. Once you still have the source of the disease and you are not eradicating the carriers, the solution of vaccinating everybody, which was applied during this COVID-19 experience, that is, once you live in a place, your contact should come for screening. They should be observed whether they will develop the disease or should also be vaccinated, so that we have herd immunity and stuff like that. That is a very great effort, but it is too money intensive. You have to involve so much money to really do all that. But there are easier, the easiest way to really tackle this problem from the WHO level, which they are doing nothing about carriers, and even the United Nations, because it has to involve the whole world. You cannot leave Africa or the areas that are endemic with all these carrier diseases. There are so many. It's not only Salmonella that you have carrier disease of cholera and co. Because we are in a global world. There is globalization. People are transporting and moving from one country, one continent to the other continent. So we must address the issue. We must address this issue very well. Like I said, if the New York and the other world, developed world, could label Mary Malon, Typhoid Mary, the most dangerous person, then why should carriers be left alone to continue to be the source of these diseases in Africa? Once a disease is endemic in an area, that area more or less is a source of carriers. So people around that area should be encouraged to come for these tests. And if government really subsidize it, people will quickly come, since the thing is endemic in that area, and they will be certificated. It's not only that when you want to travel out, for example, the yellow fever vaccines and what have you have to collect this vaccine. And how many vaccines are you going to collect, for crying out loud? But by the time you do just this carrier tests in laboratories, recognized laboratory, either by medical laboratory scientists that knows their left from their right. They will use the appropriate technique, the appropriate technology to identify the organism, the causative organism of this carrier status. Or, for example, if the causing typhoid is recognized, the DNA is extracted and amplified, then certain chemical test or sensitivity testing for the antiviral is done. Of course, that person will take the right treatment and be cured. The same person can also be monitored by a repeat test to examine whether truly and truthfully the typhoid organism is no longer in the person, that the person is no longer harboring the disease. It is easy for somebody who is sick to monitor that he has improved, but you can self-monitor himself, but the carrier cannot monitor himself or herself. The carrier has to come back for evaluation. It has to now be evaluated that no longer is the organism present in that carrier. So it is an holistic work, something that has to be done all over the world if we are all our brother's keeper, if we believe in globalization, if we do not believe that some people are meant to continue to live among dangerous people in terms of spread of diseases, then we urge the United Nations, I personally urge the United Nations and WHO to do something drastically. There should be an action plan for carriers of many diseases. Because it involves the medical laboratory scientists does not mean it has to be jettisoned at the WHO level. It must be embraced. It must be embraced by all because of the spread of these diseases that are very, very, so easy to really destroy. If you like what you are listening to, if you like the contents of what I am producing, please press the like button, subscribe so that I can produce more. The effort towards having improved health is not small. From the medical laboratory's perspective, we need a symbiotic relationship for a synergistic better health, a synergistic health where you enjoy better health seriously. Also, we know that health is wealth and knowledge is power. The more I pass this knowledge to you, the more you are powerful and healthy, because when you combine your health with your knowledge, then you have power and wealth. Thank you for listening. Thank you.